Hey guys, and welcome to the Cystic Fibrosis Q&A. You guys have been asking some really good questions about cystic fibrosis in general, and then also specifically about my health. So I thought I would sit down and take a minute and answer your questions. How old are you, and when were you diagnosed with cystic fibrosis? I am 26 years old, and I was diagnosed at 7 weeks old. My older sister has cystic fibrosis, so then when I was born, they knew to test me right away. What was it like growing up in a home with another cystic fibrosis patient? So because my sister and I are siblings, we grew up in the same household. So obviously, we were together all the time. Typically, the rules in the CF world are that you never are in close proximity with another cystic fibrosis patient. The exception to that rule is if you have a sibling or a family member who has cystic fibrosis. And because Rachel and I, my sister is Rachel, because we grew up together, our bodies were exposed to the same bacteria, so that danger of being around each other, it wasn't really a danger because we both had the same bacteria. Almost 5 years ago, my sister had a double lung transplant, and she is doing superb. And she is enjoying her life of breathing well with her new lungs. And so since she's had her transplant, she now has healthy lungs. But it's still important that we are careful when we're around each other because her sinuses are still susceptible to CF bacteria and that sort of thing. So I never share a popcorn bowl with her. I would never share a drink. I'm just really cautious, and so is she, about when we're together. We wash our hands all the time, and we just keep an appropriate distance. We just, we hang out together and all of that, but we're really cautious not to share germs, like we wouldn't share a toothbrush, of course. And that leads to probably the most commonly asked question. Mary, are you going to have a lung transplant? There is not an easy answer to that question. The answer that we have right now is that thankfully I am not sick enough to need a lung transplant. As my body deteriorates and my lungs lose function, I'm sure that this will be a discussion that we will be having with our CF care team. But for right now, we are just trying to do the best we can to keep these lungs as healthy as possible. I was just talking to my sister about this question as well, and she described where I'm at right now as this. I'm in an in-between stage of I'm too healthy for a lung transplant, but I'm too sick to live a normal life. So I'm kind of in this limbo stage of doing all I can to keep these lungs healthy and trying to enjoy life while it means a lot of coughing and a lot of treatments and a lot of medications. In life with cystic fibrosis, we have seen through each step of the journey that God has given us the grace to handle whatever is ahead of us. If in the future lung transplantation is what we need to talk about, we feel that God will give us the grace. He'll prepare us for that decision, to make that decision, and to walk us through that journey. Lung transplantation in cystic fibrosis patients is not considered a cure. And the reason for that is that every single cell in a CF patient's body is mutated. And when you take the old lungs out and put new lungs in, it doesn't change the cell makeup of every other cell in the body. The pancreas still has issues. If you have liver disease, you still have liver disease, and so on and so forth. So it is not a cure for CF. It is, however, a good solution for some CF patients. And there is a lengthy process that the patients go through before transplant. And it's the evaluation process and the testing to see if their body is a good candidate for CF or for transplant. And also to make sure that their body is able to withstand that very big surgery and the transition that comes along with it. Another tricky part in organ transplantation, specifically lung transplants, is that there are so many people in need of a transplant and there are so many people on the waiting list and there aren't so many lungs available. So if you are not already signed up to be an organ donor, please, please, please click the link below and go register if you are able. I am registered as an organ donor because I hope that if I were to pass away today, that somebody could use some part of me. I'm not sure what they would want. Maybe my skin and my eyes? I'm not exactly sure, but I figure I'm gonna sign up, and if it can be useful at all, I hope I could help out in some way. And if you're new to the idea of transplantation in general, the idea is that if someone passes away, the amazing miracle of modern medicine is that they can take the viable organs from that person's body and transplant them or put them into somebody's body who needs a new organ, whether it be a kidney or a liver or lungs or a heart. There are so many things that they can use so that when someone passes away, it isn't only a sad thing. There can also be good that comes out of it. What are your mutations? So in cystic fibrosis, there are mutations in our genetic makeup. And those mutations change the way our bodies work. And within the whole of cystic fibrosis, there are, I think, over 1,500 known mutations, and then there are also many that we don't know about. So my mutations are Delta F508 and V520F. So I am categorized as a heterozygous mutation patient. Along those same lines, people have been asking if I am eligible to use the CFTR modification drugs, Orkambi and Kalydeco. And the answer is no, I am not eligible to use those because they are not approved for my mutations. Perhaps in the future there will be a drug similar, which will be approved for my mutations. We'll just have to wait and see. In this Q&A, I'm going to incorporate a few questions from a tag that's called the Lame Lung tag, which was created by Bailey Vincent, also known as the Makeover Mama on YouTube. And if you would like to watch her video or others who have done the same tag, we will have those linked down below. And so I'm going to answer a few of those questions now. What is your personal baseline? So I judge my baseline, we've laughed recently. I talk about my baseline as far as like how many stores am I up to going to, or can I go to Target and the Dollar Tree or just the Dollar Tree? But in reality, I base it off of my endurance, the amount of coughing I'm doing, the color of the mucus that I'm coughing up, which indicates infection. So I would say I've recently realized I have a new baseline, which is coughing a lot in the morning, but then after I do my treatments and after a couple hours of being awake, I have only a few hard coughing fits throughout the day. So most of it happens in the morning. So when I'm at baseline, I can kind of expect my day to be fairly easy, not a whole lot of hard coughing. At baseline, I should want to go to 3 or 4 stores in a row and not be super exhausted at the end. As I am getting further from baseline, I'm noticing that I'm coughing really hard in the morning, but then 3 hours later, when I get up to go to the bathroom and wash my hands or whatever, just walking to the bathroom, I get in another hard coughing fit. And then an hour later, when I get up to go get a drink, another hard coughing fit. So it's kind of like once my body is settled, that mucus settles, but then right when I stand up or right when I go to do something, I'm finding myself coughing really hard. Also, the color of my mucus changes and the taste of it changes. I've recently talked about this a little bit. It just indicates that the infection is worsening. As far as my FEV1 or lung function or pulmonary function test number, Peter and I have talked about this before with you guys. We don't talk about that number on YouTube just because we don't want others to have to feel like they're comparing to us or, oh, if my number is such and such, I should be feeling this way, or, oh, if her number's only this, she should be, like we want to keep it like, this is just our experience with CF, this is how I'm feeling, and that's just how we've decided to go about it. So I'm not going to share my FEV1 number for that reason. How do you keep track of your meds and airway clearance, and what do you do for treatments? The best way I have found to keep track of my medicines is using comblers. That's a word I made up. But pill cases, weekly pill cases. So I just fill these up weekly, and I have found them to work well for me. I actually like that they're separate so that I can keep the morning one over on the desk where I always walk by in the morning, and the night one I can keep by the bed. It works for me. And then at where I keep all my pill bottles to fill these up, I keep them in a drawer, and I just keep my weekly bottles together, and then I keep all the excess, like the 3-month supply of Ursidile. I keep that down in a different drawer. So that's what works for me. I keep my vest and my nebulizer machine all next to the bed because that's where I am most comfortable doing my vest, in bed. So that's how I do it. And then when I'm on IV antibiotics, I set alarms on my phone to remind me to hook up my IV at the right time. What is your least favorite type of cough? The kind where I'm coughing really hard and I start to get a headache. Sometimes when I get a headache, whether it's from a medication or I have a fever and I also have a headache, for whatever reason I have a headache, and then I start coughing really hard, it makes the headache worse. So my least favorite cough is when I'm coughing really hard, really hard, and then right after the cough, I have like 1 second, and then it's whoa, whoa, the pain of the headache afterward. That's my least favorite. What other organs are impacted and how? I would describe CF, how it affects me, mainly as a lung disease. But in addition to the lungs, my digestive tract is impacted because my pancreas does not work properly. I do not produce the enzymes I need to digest and absorb the nutrients from food. So I take medication, pancreatic enzymes, every time I eat. I take Creon 24,000. I take 6 with meals and 5 or 4 with snacks, depending on how calorific it is. So yeah, that's what I take. Here's what they look like. So if I eat like a normal person and have 3 meals and a couple of snacks, I take about 30 a day. That dosage is based on my weight as well as the amount of pancreatic insufficiency. Over the years, they have tried me on different dosages of pancreatic enzymes, and I tend to need more, like a high-ish dose. So if I forget to take my pills, or if I don't have them on me and I don't realize that until after I've eaten, I get a really bad stomach ache, and it's basically like I never ate because my body didn't absorb any of the nutrients or calories. So I'm not gonna absorb any of the calories, and it's not gonna help me gain weight. And symptomatically, I get a really bad stomach ache and I get diarrhea. So it's kind of like when you get the stomach flu. The other job of the pancreas is to regulate and produce insulin, which is, in some CF patients, means that they have CF-related diabetes. I do not have CF-related diabetes. I do, however, have low blood sugars, and that's because my pancreas doesn't do its whole job. It slacks out sometimes. So I don't have full-on diabetes, I just have hypoglycemia. So there's 10% of the cystic fibrosis population that has liver disease, and I am in that 10%. So when I was 10 years old, I was in a research study of some sort. I think it was like a bone density research study, and they did some intake blood work just to like make sure our levels were good. When I say our, it was my sister and I. So those levels came back and my liver enzymes were elevated. So I wasn't allowed to continue in the research study, but they still paid me, which was really cool as a 10-year-old. I was like, whoa, this is a really cool job. And because I have liver disease, I am not eligible to be a part of the upcoming trials or drug testing for these new medications that are coming out. Connected to the liver is a little vein, and it connects to the spleen. That's my understanding. And I have what's called portal hypertension. So I think it's the portal vein in between the liver and spleen has tension, so my spleen is enlarged. That has I think my spleen has grown over the years, but it is now kind of at a stable, large size. So basically, I just have to be cautious about impact sports. So, I gotta really hold off on like doing football and stuff. It's really, you know me. So anything that could ram into my abdomen area could cause my spleen to rupture. In other words, my spleen might explode. So I just have to be careful, and it's been like that since I was 10 or 11, and so I'm just careful about it. I have had a few splenic infarctions. I mean, come on, how cool is that word? Which basically means that there's a portion of my spleen that died. It's a really odd situation, but it's happened twice, so I have 2 small dead parts of my spleen. But anyway, that's my spleen. So basically, the organs that are affected is pretty much everything, but specifically the things that I go to specialists for. Lungs, my pancreas, my liver, and my sinuses. I've had sinus surgery. Do you ever get tired of medication? Yes, I do. So much. When you're out in public and having a hard coughing fit, what do you think about when other people are looking at you? So I know that it is a tricky thing because it's not normal for a young-looking person to be coughing really hard. And I'm sure that people are thinking, well, from the looks that I get, here's what I have concluded people are thinking. Whoa, you are so sick, you need to go home. Whoa, get away from my child, I don't want them to catch what you have. Wow, honey, you need to stop smoking. I mean, I don't really know what they're thinking, but I get a lot of like looks that kind of say a lot of things. And honestly, I don't blame them for it. It makes sense. I look so healthy, but I sound so awful. So it's normal for people to stare. But somebody asked, would I rather somebody just stare at me or come up and ask me what's going on? And my ideal situation would be for them to ignore me and just pretend like it's normal, because it is normal for me. But I am okay for somebody to come up and ask about my cough. I've had people say, oh, you have a cold? I just say, no, I have cystic fibrosis. This is my normal cough. Or if I'm like sitting next to somebody at an event or at church or something like that, and I'm coughing a lot, I will usually just quietly say to them, I have cystic fibrosis. I'm not contagious. Just because I've had people like move their chair away from me or whatever. I don't want them to be worried that they're going to catch what I have. So it's not a fun thing to deal with people staring. But typically it doesn't really bother me. Whatever. People often, if I am at church or at an event or at a hangout with people or something like that, people often offer me cough drops and a glass of water or a bottle of water or whatever. And the cough drop thing, so cystic fibrosis patients aren't supposed to take cough drops because our bodies are needing to cough to get the mucus out, so we don't want to suppress what our bodies need to do. So I don't typically take cough drops. I personally don't choose to accept the cough drop because they probably have the cough drop because they're sick, so they probably reached their germy hands into the same bag and got one out. So I just say, oh, thank you, that's okay, I have cystic fibrosis. I say it real quick and then just like, I'm sure I try to say thank you, but for water, I'll usually accept it because, I mean, it's good to stay hydrated. But I recently had somebody say, so when you were coughing in that meeting and somebody gave you water, did that help? And I was like, no, not at all. And they were like, well, I saw you take a drink. And I was like, yeah, it was a courtesy drink. So Typically, water doesn't help because it's not like a tickle in my throat. Sometimes I do get a tickle in my throat and water helps, and that's fine. But typically, I'm coughing because my lungs are so filled with mucus and my body is telling them cough. So water doesn't typically help, but water's good for the body, so I drink it. What are the best clothes to wear as a cystic fibrosis patient? I made this question up, but I think it's important. Pajamas and sweatpants but no, for real. I like to wear comfortable clothes, but on the other hand, I also like to wear fancy clothes sometimes, because sometimes when you don't feel well and then you put jeans and boots on and you wear fancy stuff, then you feel like, hey, I look normal, I feel normal, which you don't, but at least you look kind of normal. So I like to wear a lot of comfy pants, as you guys have seen in the vlogs, but sometimes, once in a while, I like to get dressed up. Are you alarmed when your body suddenly needs to cough? Yeah, sometimes when I'm just going about my normal business and then I have a really hard coughing fit, like really suddenly, it is alarming. And somebody once noted that in the vlog, when I start coughing really hard, sometimes I get a look in my eye of like, I'm scared, and it's true, like, it can be scary. I'm very used to that hard cough. That's what my body does every day, multiple times a day, so I'm used to it. But recently, there have been a number of times where when I'm in that hard coughing fit and you're breathing out, like, and then right when your body needs to take a deep breath in, my mind says, okay, now you're gonna breathe. And then my mind's like, right? You're gonna breathe, right? And then it's like a second of panic before my body takes that deep breath in. And that has happened a couple times recently, and it is terrifying. I think that is the only way to put it, because it's that feeling of my mind is telling my body to breathe in and my lungs are not doing it. It's something that I've had to get used to. And 26 years of coughing, you get used to it. Is it possible for people with cystic fibrosis to have babies? We answered this question in our first Q&A, but I will answer it quickly here as well. Yes, it is possible for people with cystic fibrosis to have babies. No, I'm just kidding. I will elaborate. Our bodies, I'll speak for women's bodies. Men's bodies, I think, are 99% sterile, meaning they don't produce, or it doesn't work out. It just doesn't work out, I think. I'm not sure. But I know of men who have cystic fibrosis who have children, so it's not impossible. For women, our bodies can do it. Like, our bodies can conceive and carry a baby. There are risks involved, just as there are risks for like a normal person when they're, carrying a child. Those risks are the same and greater for cystic fibrosis patients. I have a friend who has had a baby, and it works for some people, and for other people, it's just too dangerous. Peter and I have decided that it would not be wise for me to get pregnant and have a baby. So at this point in our lives, we have decided not to have children, and we elaborated more on that in our first Q&A, which we will have a link to down below if you would like to hear more about our decision. And warning, there are tears involved, but it's real life, people. It's real life. How do strangers react to your disease? You'll find a lot of people who are like, oh yeah, I've heard of that. What is it again? Whether they read it in one of the pages in their biology book, or they know a friend of a friend who had it, or whatever. Some people have kind of a loose idea of what cystic fibrosis is, but there are other people who have never heard of it. So I usually just say, I have cystic fibrosis. It's a genetic lung disease that I was born with, and it's an everyday battle. And if we have a longer conversation, I go into more detail. Yeah, sometimes I feel the need to elaborate and say it's not contagious, especially if there are kids around. I just don't want the parents to think like, oh, get away from my kids or something. How often do you go in the hospital? I usually go to CF clinic, outpatient, about once a month or so. Unless I'm on IV antibiotics, then it's once a week. But usually it's about once a month, sometimes a little bit longer, sometimes a little bit shorter. And then about every 8 to 10 weeks or so, sometimes a little longer again, sometimes a little shorter, I need IV antibiotics to help get the infection under control a little bit more. So usually I will go into the hospital for a week or a little bit less to start my IV antibiotics. I get aggressive chest PT, like physical therapy to try to like get my lungs a little bit clearer. And then I go home on IV antibiotics. I have a port. We made a video showing you guys all about how we access my port. And so since we're independent with my port care, we can do all my antibiotics from home. The last few times, though, I've had so many side effects from the IVs that I'm almost more comfortable staying in the hospital. So we'll see how it goes the next time around. Maybe I'll choose to stay in the hospital longer just because with all the side effects, I don't know. And sometimes I need to stay in longer to try to get my blood work stable, or if I'm on a drug that needs blood levels. So there's many reasons I go into the hospital, but when I come out of the hospital, the main reasons are I am independent with my portacath. With Peter's help, we can do the IVs and do them on time and all of that. And Peter's able to do chest PT for me, so that's super helpful. But there's a time and a place to be in the hospital, and for us, there's sometimes a good time to come home. So that's how we do it. So there you go, some answers for your questions. And if you guys have more questions specifically about CF and the population of CF patients, the Cystic Fibrosis Foundation website has so many answers. And when we made that cystic fibrosis quiz, we were on their website using their data. So they are a great resource for questions about CF and treatments and the drug pipeline of what's coming out and all of that. So that's a great place to go for more answers. And as we said, we have many other videos answering questions about just life in general, about my service dog, about my port, all of those sorts of things. So if you are interested in finding out more about life in general in the Fry household, those links will be down below. And thank you so much for watching, and thank you so much to the very many people who have chosen to become a part of the Fry life and to come on this journey of cystic fibrosis with us. Thank you and good night.